Has your doctor ever told you that he cannot find the cause of your decreased vision and yet you have got decreased vision? If this is the case, then this video is for you, my friends. Hello friends, this is Dr. Ankit Barot from Dr. Eye Care. I am a consultant ophthalmologist at Vasudev Kutumbakam Eye Hospital. Today I am going to talk on what is amblyopia. First I'll start with what is amblyopia, then I'll come to causes, what are the types, what we experience with specific types, what is the treatment and what are the treatment issues. Now starting with what is amblyopia. Amblyopia is unilateral, less commonly bilateral reduction in best corrected visual acuity for which no physical abnormality in the eye or posterior visual pathways can be found. Quite a complicated definition it is, but I'll explain you bit by bit. Unilateral or less commonly bilateral. Generally it is one-sided, can be on both sides, but that is less common. Reduction in best corrected visual acuity. It means that your best corrected vision, that can be corrected by glasses or contact lenses, is reduced, and no structural abnormality in the eye or in the pathways connecting eye and the brain can be found. That is amblyopia or lazy eye. Coming to the types of lazy eye or amblyopia, there are three types. One is squint induced amblyopia, two is high refractive error induced amblyopia, 3 is stimulation deprivation amblyopia. Coming to first, squint induced amblyopia. Here there is squinting of the eye that leads to amblyopia. In high refractive error there is blurred image on the retina which causes amblyopia, and in stimulation deprivation what happens is the retina does not get the stimulus for proper development and the retina or the brain develops amblyopia. Coming to what you experience when you got amblyopia. First of all, you will experience that your central vision is bad but your peripheral vision is good. There is a central dense scotoma in amblyopia. Also, you will see that there is crowding phenomenon. That is, a letter of similar size when isolated alone you will be able to appreciate, but when it is crowded by other letters of similar size or vertical lines or bars, you will not be able to appreciate the letter. That is crowding phenomenon. Now what is that you experience with specific types of amblyopia? If you have got squint induced amblyopia, what we find is you have got reduction in grating acuity. That is, uniformly spaced stripes acuity would be more reduced than the Snellen's acuity. Then there is a neutral density filter effect. That is, if a neutral density filter is placed in front of the amblyopic eye and it is placed in front of the normal eye, then the reduction in visual acuity would be less in amblyopic eye and more in the normal eye. And also there is eccentric fixation. In strabismic amblyopia, we find eccentric fixation. It could be found by a device or an instrument called visuoscope, which can find small degrees of eccentric fixation. For larger degrees, it can be clinically evident. If it is clinically evident, eccentric fixation, then visual loss is severe. If we have got a high refractive error in a single eye and it has caused amblyopia, then what we find is +1 to +2 diopters of hypermetropia causes mild amblyopia, greater than -6 causes severe amblyopia. If we have got high refractive error in both eyes, then greater than -6 and greater than +5 diopter of hypermetropia will cause mild sort of amblyopia. For stimulation deprivation amblyopia, what we find is cataracts causing amblyopia. Also, vitreous hemorrhage and corneal opacities have been implicated. Now, coming to treatment, or what are the potential ways by which we can treat it. There are 3 steps to treatment of amblyopia. First of all, you remove the obstacle. There is any obstacle in the visual axis, you remove it. Second is correct the refractive error, and third is you limit the use of the good eye and encourage or force use of the worse eye. So first step is remove any obstacle. If you got a cataract, remove it. If you got a vitreous hemorrhage, remove it. If you got a corneal opacity, if you can improve it, improve it. Second is correct the refractive error. That is, by cyclophysic refraction, you find out the full refractive power and give full correction. After that, what we have got is limit the use of good eye and encourage the use of the worse eye. What we do for that is patching or atropine or homatropine eye drops. Generally, I encourage patching. Patching can be of 2 types. It can be adhesive plasters which can be stuck to the skin, or spectacle mounted patches. With adhesive skin patches, we have got irritation issue with spectacle mounted patches, we have got sneaking around the patch issue. But whichever is comfortable can be used. Coming to how much patching you should do. If you got mild amblyopia, 2 hours of patching is good. If you got moderate amblyopia, then 4 hours of patching is good. If you got severe amblyopia, then 6 hours of patching should be good. Now, coming to compliance issues or treatment issues. What we find is that the child might not follow the instructions or the parents might not follow the instructions. The parents generally may not be comfortable with a particular method, so they should be like the issue has to be sought. We have to find what the issue is. If they are not comfortable with the skin patch, we should encourage them to use the spectacle mounted patch. If they are not motivated enough, then the importance of the project has to be emphasized. They should be told that initial days would be difficult, but after that things would become easier, because once the schedule is established and maintained, then improvement in amblyopia will ensue, after which the motivation will increase and they are more likely to stick to the treatment pattern. Now, other things which can happen with compliance issues is the child not following. If it's an infant or less than 1 year old, then what we can do is we can restrain the child and the child has to wear a patch. But if it's a toddler, that is 1 to 3 years, that is difficult. If it's greater than 3 years, what we suggest the child is, while wearing a patch, the child can play a video game. That is good enough. Now, coming to the end, what I feel is that it is sad that we have got vision loss due to amblyopia, because it is preventable as well as treatable. But it is sad that we still find vision loss due to amblyopia. What I suggest is that there should be screening at 1 year of age for children, also at 2 to 3 years of age, and third screening should be at 6 years of age. More screening would be definitely welcome. I have tried my level best to explain all that is to amblyopia. Even after this, if you have got a doubt or query, please post in the comment section below. For more such informative videos, please subscribe to my channel. Thank you for watching.